Hi, I'm Dr. Ahmed Nasser. I'm a plastic and reconstructive surgeon at the Institute for Advanced Reconstruction and the Plastic Surgery Center. Occipital neuralgia is a very common neuropathy that occurs in the back of the head. The symptoms of occipital neuralgia most commonly are pain or burning in the back of the head. Usually this is just below the prominence that we have in the back of our scalp. That pain usually spreads in linear fashion forward or along the sides of the head. Additionally, other sensory nerves that we have in our face and temple, as well as above our eyes, can be compressed, and these can be also triggers for migraines. In terms of treatment options, there are many that start with migraine medications themselves, which there are a lot of new generation medications that are very specific for migraines. However, what we aim to do is actually target the triggers of migraines. So the trigger for migraine in this case are the compression neuropathies of the occipital nerve or other sensory nerves. So this can be done with Botox injections, which relax the muscles around these nerves. Can also be done with nerve blocks. Ultimately, if the patients have good but temporary relief with these measures, then decompressive surgery can sometimes be a curative solution for these patients. So on the day of surgery, the patient will come in. We will make some marks on the back of their head after shaving a very tiny area. That will be where the incision goes. We'll locate exactly where their trigger points are and confirm that with them. Once everything's marked, we take them back to the operating room. We do our surgery as we explained before. And then afterwards, we usually at the end of the procedure will leave a very small drain to help with fluid management, which comes out couple of days later, and then they go home the same day. We usually will ask them to engage in light activity, not exert themselves, no heavy lifting or exercise while they're in their early recovery period. So after occipital neuralgia surgery, when we have decompressed the nerves, it takes some time for the nerve to recover and resume its normal sensory function. So one thing is that patients will universally have numbness in the back of their head, but it may take up to 6 months to see the final outcome of the surgery, meaning that the trigger for the migraine itself, the occipital neuropathy, has subsided.